At South Texas Health System Children's, your child's health is our priority. When they're ill or injured, we're ready to help. Our team includes on-staff pediatric specialists in infectious disease, cardiology, orthopedics, neurology, ear, nose, and throat, and more. Our round-the-clock care features the Valley's first dedicated children's ER. For more than 15 years, we've offered healing and hope for kids. And we're here for your family now. South Texas Health System Children's.
Where kids come first.
Good afternoon and welcome to our latest Let's Talk Children's Health webinar. I'm Tom Castañeda, the System Director of Marketing and Public Relations for South Texas Health System. On behalf of STHS Children's, thank you for joining us. There's no denying that the health and well-being of their children is paramount for parents. So to help parents better prioritize their children's health, STHS Children's launched these Let's Talk Children's Health webinars last year. Through awareness and education on health issues that affect children, parents can be better prepared to ensure their children's health and well-being. In this installment, we'll be talking about autism. 1 in 36 children in the U.S. has been identified with autism spectrum disorder, according to the CDC. The neurological and developmental disorder affects how people interact with others, communicate, learn, and behave. While autism can be diagnosed at any age, it's described as a developmental disorder because symptoms generally appear in the first 2 years of life. So to commemorate National Autism Awareness Month, we've invited Dianira Negrete, an early childhood interventionist and speech pathologist with Region 1 Educational Service Center, to help provide important education, information, and resources related to autism spectrum disorder, including the early signs of ASD in kids, how it affects them, and how the disorder is commonly treated. Thank you so much, Didi, for joining us.
Thank you, Tom, for inviting me.
Now, Region 1, you all have been in the community for a long time, and your program, your early intervention program, is really critical in this community to catch autism early, right?
Absolutely.
How active are you guys in the community?
So in the community, we do a lot of health fairs, we do a lot of outreach, but primarily what we do is we provide support to parents and families and the children in the home. So we receive a referral, if a parent has some sort of concern in terms of the child's development, we'll do an evaluation, we assess the child, and then just determine if there's any type of delay. In terms of children being on the autism spectrum, we definitely do not diagnose autism, but we guide the families and to help the children, as you mentioned earlier, communication delays, sensory processing delays, so we work with the children in that way.
So you guys are able to sort of tell when there are some signs that there may be some autism, and that way you can refer them to a pediatrician or their physician to make sure that they're catching it, and then you guys can work with them to make sure that they're getting the services, the resources, and the treatment that their child needs, correct?
Right, correct. So a lot of times the pediatricians do not label a child with autism till they're 3.
Okay.
But we can definitely see the signs and symptoms early on. And what we tell the families is we're not necessarily treating the diagnosis, but we treat the child. So if the child is showing some sort of delay in their communication related to autism, say like the lack of joint attention or the lack of turning to their name, we'll work on those skills to help them, overcome some of the symptoms of autism, so that by the time they turn 3, they're school age ready and they've gotten some good foundational skills.
That foundation is critical to make sure that learning isn't impacted. Now, in the Rio Grande Valley, I know we talk about the numbers, 1 in 36 children in the U.S. Do we have sort of that same ratio here in the Valley, or do you think it's a little bit more common or less common?
Specifically to the Valley, I don't have a specific number. However, there's some days when I evaluate 4 children, and of the 4 children I've evaluated, 4 appear to be on the autism spectrum.
Okay.
It's usually at least 1 a day that we evaluate. It's becoming definitely much more prevalent in the children that we see in our ECI program.
Yeah, that increase that I think we're seeing, because I remember about 2 years ago, it was 1 in 40 kids, and now it's 1 in 36. So I think that prevalence is increasing across the board.
Definitely. I was reading a statistic that said in 1990, it was 1 in 10,000 children were diagnosed as being on the spectrum. So it's definitely much more prevalent now. And I'm not sure if it's because we have more research, we're able to identify some of the symptoms or characteristics of this being on the spectrum earlier, that it's become much more diagnosed earlier.
Now you have a great presentation for us
you.
that will have a lot of important information, so let's get started.
All right, let's get started. Okay, so what is autism? Autism is a developmental disorder with symptoms that appear within the first 3 years of life, and that's according to the Autism Research Institute. As we mentioned, autism is a spectrum, meaning that children can have some very minor characteristics to much more severe characteristics. But the formal diagnostic name now is autism spectrum disorder. Before, we just used to refer to autism as autism, but now we've come along and we understand that it's much more of a spectrum, that no two children's characteristics appear the same. So autism is considered to be a developmental disorder. Well, why developmental disorder and not just like a psychological disorder? It's considered developmental because the characteristic of autism, they start as early. I think that the child that I've seen with the earliest symptoms probably is about 9 months until they're about 3 years. So we see the delays in the different aspects of development early on. So some of the common characteristics of autism, according to the DSM-5, which is a manual that the doctors use to diagnose all of us or diseases, so they can have difficulty with communication and interaction with other people. So many times a child does not necessarily turn to their name right away. So mom calls, the child doesn't respond. That doesn't necessarily mean that the child is not hearing, it's just they're not making that connection to turn to their name. Restricted interest and repetitive behavior. So lots of times also when we go into the home, we see like an intense interest in one particular toy, like dinosaurs or cars. And that repetitive behavior usually looks like a child lining up their toys. And if we were to move the toys out of the line, sometimes they get very upset with us. Another repetitive behavior that we see often is picking up and dropping the same toy. So it can be a puzzle piece, and instead of the child being able to put the pieces into the puzzle, it becomes more of a repetitive, not so functional play with that toy. And symptoms that affect their ability to function in school, work, and other areas of life. One of those characteristics sometimes is sensory processing. So if things are too loud, the way clothing feels, even the line on socks can affect some children. One of the most prevalent ones that we see is reduced eye contact, differences in body language. And that looks like flapping maybe of their hands or looking out of the corner of their eye. So not looking at you, but looking at the corner, out of the corner of their eye. Sometimes body, instead of sitting up straight, lots of times more withdrawn. Lack of facial expressions. So when another child might be giggling, a child that appears to have characteristics of being on the autism spectrum is not necessarily smiling and thinking that the same things are funny. Not engaging in imaginative play. So lots of times children who present with characteristics of being on the autism spectrum prefer to play alone. Not an imaginative play in terms of like two dinosaurs playing back and forth or roaring back and forth. Closely focused interest, as I mentioned earlier, that intense interest in like dinosaurs or in cars. And indifference to temperature extremes. So lots of times we'll go into a home and a child who shows us some characteristic or kind of triggers us thinking, that might be a characteristic, is if it's 120 degrees outside and the child is under a blanket and sweating, and it doesn't seem to bother the child at all. So with children on the spectrum, they can have all of those characteristics that I described or none of them. Also, autism spectrum presents differently in girls than it does in boys. And also, some of the characteristics that I described does not necessarily mean that if you have one of those that you have autism. It could just mean that that's the way you behave. And it's also important to note that as a speech pathologist or as a speech pathologist, I cannot diagnose autism, and only a physician can diagnose autism. How is it diagnosed? Well, first of all, like if they were to do blood work, there's no known biological marker yet for autism. There's lots of studies that are being done now that are looking at genetics. They're looking at blood work, hearing, to determine if there's some type of markers that would show autism. So what a doctor does when they're going to diagnose is they'll take a complex medical history and questionnaires to determine whether an individual has autism. And the questionnaires usually, because lots of times if there's twins and one twin has autism, there's a high chance that the other twin will have autism. Or if there's one sibling that has autism in the family, there's a high chance or high probability that other siblings will have autism as well. So what happens when a parent or there is concern for autism? There's several things that can be done. There's a modified checklist for autism in toddlers called the MCHAT. And the MCHAT is a 20-question test designed for toddlers between the ages of 16 and 30 months. The MCHAT is one of the measures that is recommended by the American Academy of Pediatrics, and it's recommended that for all children who go to their well visits that they be screened at 18 and 24 months. And within our program, if we assess a child and there appears to be some characteristics of being on the spectrum, we'll ask the families, would you like us as a team to administer the MCHAT for you? And sometimes they say yes, sometimes they say no. Another really, really important screening tool is called the Ages and Stages questionnaire. And that's a general developmental screening tool with sections targeting specific areas used to identify any developmental challenges that a child may have. So that screener looks at communication, fine motor, social emotional skills, gross motor skills, and cognitive skills. And we look at those, in that screener, it looks at their behaviors across different areas. So if a child goes to daycare, when an ASQ is administered, they'll ask the teacher, they'll ask the parents, and maybe even other family members to compare their responses to see that they're all on the same page and that they're seeing the same characteristics. So with the ASQ, and the importance of the ASQ is that we believe that screening can identify your child's strengths and uncover new milestones to celebrate and reveal any areas where your child may need support. And it also helps you to take and understand the areas in which your child may be delayed. And most importantly, it's critical in your child's first years of life, especially those of us who work in early intervention, to identify these characteristics or these delays, because we truly believe that early is best. So after the screening, what happens? Usually after a screening happens, a discussion is had or is made with the child's pediatrician, who might then refer a child to a specialist. Some of the specialists that focus on the diagnosis of autism would be like a psychiatrist or a neurologist or even a developmental specialist, such as a developmental pediatrician. And also in some cases, the prevalence may be so clear that the pediatrician might even then and there diagnose the child with being on the spectrum. And I think one important point is that it's important to be diagnosed with autism, not because we want to identify so many people, but so that children can receive the help that they need, especially going into the school district, that once they get into the school, their IEP or the plan that the school district makes with them has the appropriate modifications so that the child has success in the classroom and also in social settings. I feel like if family members know that a child might be sensitive to sound, that they're more sensitive, say like in family gatherings, not to turn up the stereo or to be more aware of the child's needs. So what do you do? What do we do in our program when we receive a referral for a child who's on the spectrum? Well, we recommend therapy services. And with ECI, with early intervention, we have speech-language therapy or occupational therapy, which would work with a child on the spectrum in terms of sensory, using their hands and play. Gross motor, we have physical therapists that work on big muscle movements. Oftentimes, it's a common characteristic that a child who is on the autism spectrum may have low muscle tone because maybe they just prefer one position. So sometimes, or even tiptoe toe walking, physical therapists work on that as well. We have behavior intervention specialists who help with some of the behaviors or help the children being able to transition from one activity to another, and also being able to be told no. And overall, I want to say our most important goal in early intervention is teaching that joint attention, working together, having that communication. And communication is not only through words, but it can also be through gestures and pointing. So in the Valley, we have 2 early intervention programs. We have Region 1, which I work for, and Region 1 covers the areas of Edinburgh, Edcouch Elsa, La Villa, Monte Alto. Then we jump over to Los Fresnos, Brownsville, Port Isabel, and all the way to Padre Island. Another ECI program in the Valley is Easter Seals. So any other McAllen, Farr, Mission, those children who would like or interested in or who need early intervention services would be serviced through Easter Seals. So our phone number, if any parent is interested in receiving a screening or would like some more information about what is autism, our phone number for Region 1 is 956-984-6131. We also have a toll-free number. It's 1-855-651-1960. If you have any questions, I'd love to answer them for you, especially if you just have any concerns. It's also important to note that if a family would like an evaluation with ECI, it's free. If a child doesn't have insurance, if the child's insurance doesn't pay, they would never receive a bill for the evaluation. I know, Tom, you'd asked me to prepare some local resources for our presentation today, and so there's some that come to mind that are very active in the community in terms of working with families and children that are on the autism spectrum. So one of them that comes to mind is Team Mario. And that's a nonprofit organization that supports and advocates for children and families affected by the autism spectrum disorders. Their website is teammario.org, and they also have a Facebook page that's very active. I know with Team Mario, they have support groups, they have outings, they have summer camps, music camps. Another organization that works with children on the spectrum is Capable Kids. And also that's another nonprofit organization that aims to identify and address social and physical needs in all children. And their website is ckrgv.org. And then the Disability Chamber of Commerce, RGV. And that's a really special program because it's the 4th Disability Chamber of Commerce in the nation. And they promote inclusive employment opportunities. So once a child comes out of school, they work to have job placement in different businesses in the Rio Grande Valley. Some national, I know you mentioned Autism Speaks is really, really big. It's got lots of information. The National Autism Research Center, there's hundreds of, all the families would have to do is type in autism research and hundreds of websites would come out.
And there is a lot of information, but you also want to make sure that you're going to a trusted source. So
Absolutely.
that you are going to someone that is reputable, because unfortunately a lot of people pay attention to TikTok or social media,
Yes.
and they're getting information that unfortunately is misinformation. So making sure that you're checking those sources, and it's great that we have local resources here that are available.
Yes. Definitely not TikTok. I definitely wouldn't base my diagnosis or a parent's concern off of TikTok, but that is what's out there. So lots of times when we go do evaluations, the families will say, well, I saw on TikTok that, and we just kind of reassure them that maybe, but we encourage them to ask their physician or talk to their therapist before referring to TikTok.
Yeah, to speak to an expert
Yes,
first.
absolutely.
Yes. Now, when a parent finds out that their child may be autistic or they are diagnosed with autism spectrum disorder, I mean, I can understand the wealth of emotions that they'll be going through. What is the most important thing for them to remember?
The most important thing for them to remember is that the child is still their child, and they might not be learning or looking, their milestones might not look the same, but they're going to learn, they're going to communicate, and with the most support, the most therapy, the doctor's visits, and everybody that's on board, the more success the child will have.
Mm-hmm. And ultimately, a parent will have so many roles that they're going to be taking on.
Yes.
They're obviously the caretaker, but they're also doing so much more. But the most important thing is that they are going to be their child's advocate.
Absolutely.
Right? They have to make sure that they're doing everything that they can to make sure and ensure that their child gets the education and gets the services they need. Is that right?
Yes, definitely. And some of these organizations that I mentioned, such as Team Mario, Capable Kids, the Disability Chamber, were founded by parents who have children on the autism spectrum, and they felt very passionate about local resources for families and to support parents, because it's a big diagnosis. We've come a long way in terms of accepting autism, When I first started as a speech language pathologist, it was not very common. Like, we didn't really even discuss it too much. Or in my graduate school courses, we didn't talk about it. But now it's very prevalent. And so we, as therapists, we offer a lot of support to the families now as well.
And that's part of breaking the stigma when it comes to mental health in general, and autism obviously being one of those issues that we really want to make sure that we're addressing, one of those conditions that gets the respect that it deserves. Now, when you are being an advocate for your child, there are some things that are recommended, and maybe you can expand on this. So obviously taking responsibility and being a leader for your child.
Right.
So learning as much as possible, becoming an expert yourself.
Absolutely.
So getting as much knowledge, right?
Getting as much knowledge that you can, speaking to the doctors. I mean, I know our physicians are very busy sometimes, but asking lots of questions, going into the doctor's office with a list of questions and being prepared. And also, I think parent-to-parent support is really important. Finding your network, finding your group of parents that you feel comfortable with, and speaking to and giving advice and receiving advice from. And your school districts. Most school districts have an autism specialist on staff, so they're also a great support to children, teachers, and the parents. Okay,
I see here that it says, speak with authority, be proactive. So I know that in Latino culture, we really don't speak up a lot. It's about saving face and making sure that we don't, disarm anyone, but we have to be proactive for our children, and we have to speak up and make sure that we're getting all of the information we need, right?
Yeah, you hit the nail on the head about, in our Latino culture, many times it's what the doctor says and that's it. And one of the things we speak to the families about is it's okay to ask questions. Follow your mom heart. If you need a second opinion, that's okay. If you saw a neurologist and you'd like to see a developmental pediatrician, that's okay. Also, ask questions in school. Be the voice for your child who might not be able to speak at that time.
Now, when it comes to supporting your other children, how do you help to support the rest of the family and make sure that there isn't some sort of resentment? I know that there's fears of resentment that someone's getting special treatment and things like that. How do you address that with parents when they're dealing with a larger family?
Sure. So one of the things that ECI, early intervention specialist, every child that's in our program has what we call case management services. And that's also linking families to resources. And we speak to the family about these issues. So one of the main things is to include their siblings in all the activities that we're doing with the child on the spectrum. Children are children's best teachers. So if there's other children in the home while we're doing therapy, we include them in the session and empower them as well to be a voice for their sibling who's on the spectrum. And we also just remind the families that every child is important in the home, because if a parent is only spending so much attention on the child on the spectrum, another child might begin to act up. And we kind of give parents resources for self-care, and to learn to value each child.
Now, when it comes to explaining autism to an autistic child, and what advice do you have for parents who sort of have to explain why they're getting these extra lessons or whatever it may be? How do you explain that as a parent?
So as a parent, I would explain that by saying that your sibling or your brother or sister learns differently. They see the world differently. So we're just helping them to learn to communicate and say words, but definitely just explaining that a child on the autism spectrum is bright, can learn, is communicating, but they just do it in a different way.
Now, how important is it to give yourself time to adjust? When you hear that news, I think a lot of the times parents react quickly, and you have to give yourself a moment to take a breath and just really let it all sink in, right?
Absolutely. So as therapists, many times when a parent has received the diagnosis from the pediatrician or from the neurologist, they're not ready to speak about that their child is on the spectrum, and we respect that. Some parents, we go into the home and they're very ready. They want to talk about it. They want all the information that we can give them. So we respect the parents' time and ability to work through their emotions.
Now, how important is it to build that network? And you've touched on it a little bit, but how important is it to make sure that you have those resources available to you, that you have your army, that is going to kind of help you?
It's extremely important. And I can't imagine going through receiving the diagnosis of autism for your child without having that support system. So starting with your friends and your family, helping your family to understand that the child is learning different and might need some modifications, but not to exclude the child from any family affairs or family events. Another one is parent to parent. As I can imagine that I don't have a child on the autism spectrum, but I probably wouldn't be the best resource to talk parent to parent. I'm a therapist and I can give them therapy advice, but finding your friend network is important. Your school district, finding a school district that has special services and that is supportive of your child is also very important. So all of your community, everybody that you surround yourself with is important.
And how do you have those conversations? Let's say your family loves to go to church, and how do you get your church to understand and accept the situation and make sure that they're being respectful and understanding of your child's needs?
So one thing I want to say, Tom, is because of conversations that we're having today, there is much more acceptance for children being on the autism spectrum. When my children were little, it was different. Everybody turned if there was a child on the autism spectrum and looked. Last year, when my son had an awards assembly, there was a child on the spectrum who received his diploma, and the student body kind of did the silent clapping because they respected that the child had differences and was sensitive to auditory stimulation. We're growing, and like I said, these conversations, talking to people, using words like autism spectrum, help everyone in the community. And
people are open to
Yes.
change and to be more accepting, but you have to be the advocate once again to make sure if they don't know, they don't know. And
Right.
so I know we like to try to be private a lot of times, but if you can have those honest conversations, it can lead to growth.
Absolutely.
As a community.
Absolutely.
Now, why is early intervention so important?
Wow. We believe early intervention is best, and it's best because at that time the child's brain is changing circuits. There's synapses that are going on, there's plasticity, there's all these things going on in the brain between birth to 3. And so we believe in early intervention, that what we teach the family and what we teach the child can help have an impact on their life forever. Basically, we believe we set the foundation for their future.
Now, why do children with autism have difficulty learning in a regular classroom setting?
That depends on the child. So one of the things I've learned is to know a child with autism is to know that child with autism, because it's a spectrum and all children are different. So some children in a classroom might have difficulty with the sound being too loud. The fluorescent lights might be something that is too much for them. Sitting in a chair, maybe they need to move around. That might be also difficult. Therefore, early intervention and us being able to transition the child into the school district with a plan, they can have success from day one when they're in the school, as the school district will have modifications ready for them.
All right, so you create this plan and it tells you, let's say that they are sensitive to the light, the fluorescent light. So then the school district obviously knows, okay, we should put them in a room that doesn't have fluorescent lights, or if it's a sound thing, we should make sure. So that plan is something that obviously is the plan of attack when it comes to making sure that they're getting the best education possible. So that's why, again, early intervention is so key, because you're able to find all of those things. So if a parent, obviously if the diagnosis doesn't come until they're 3, and let's say they aren't able to call you right away, what are if they should be sort of taking account of those things that they're noticing with their child? Like every time we turn on the TV, let's say, and that noise, they get irritated, starting to make those notes, right? What advice do you have for them as they're kind of starting to prepare to possibly go and see a specialist? Or
so definitely notes, a journal of things, like if you were changing the child and something in the shirt, the tag triggered a temper tantrum or triggered a meltdown, maybe note, okay, no tags in the shirts, or not those socks, these socks, not green vegetables, just potatoes. So learning all the things that your child likes and putting them in writing, so that when your physician asks you those questions or more detailed questions, you've got specific answers.
Yeah, it's always good to come in as well prepared as
Right.
possible and have
Right.
as much information as possible to really talk to your doctor.
Right.
And I think with any health condition, I know people, they'll ask me, well, what medicines are you on? They're like, oh, I think I'm on this and that. But if you
Right,
come in with a
right.
journal and you're detailed, it
Yes.
just saves you the time and the energy to make sure you're getting the proper diagnosis
Right.
and the proper treatment.
Right. And Tom, that's why, the American College of Pediatrics recommends screenings. They're by law, or it's a federal law, that they receive those screenings at their well visit checkups, so that well baby checkups, so that we don't miss the diagnosis or miss the opportunity to offer early intervention. But if it does happen, and it does sometimes, and a parent has concern, they can call the school district if the child is 3.5, and the school district provides an evaluation even at that time. Even if the child is not enrolled in the school district yet or has not even attended school, they can have meetings, they can do the evaluations to prepare the child for school.
And I know culturally here in the Valley, a lot of people don't have primary care physicians. Maybe the family doesn't have a pediatrician, but it's important to go and get those
Absolutely.
regular checkups, because they are looking at those markers
Absolutely.
and making sure, and they're able to find it, hopefully, and intervene faster, right?
Yeah, definitely. I mean, a pediatrician should feel like your parents, as a parent, are right hand. They're also advocates for us, because as parents, sometimes we're so close to the forest that we can't see the trees. We might overlook some of the things because that's our child and we're used to that. So regular checkups with the physician, your well visit screenings, all those things are so very important, and they're in place for a reason.
Mm-hmm. All right, so let's talk a little bit about tips for parents who may have an autistic child. So obviously these are some advice that was provided by Autism Speaks, and I think that maybe we can touch on it a little
Okay.
bit. So allow the feelings and emotions.
Sure. Like anything, let yourself cry. If you receive the diagnosis of your child being on the spectrum and you want to cry for a week, that's okay. Feel it, and then once you're ready, then we can help you move on. Or if you're not ready, that's also okay. But feel it, go through it, because that way when mommy or dad is in a good place, then so is the baby, so is the child.
Mm-hmm. I grew up with this AMO principle: acknowledge, accept, and move on. So acknowledge it, allow it, accept
Yes.
it, but then move on, and make the
Yes.
changes. But you
Yes.
need to allow yourself to acknowledge it
yes.
and feel it and be in that moment.
Absolutely.
Yeah, now let's talk about realizing you are good enough, because I think a lot of the times parents will blame themselves for any issue.
Absolutely.
You are good enough,
Yes.
and you can do this.
Yeah, definitely. And that's one of the supports that we provide sometimes in the home, is just, that's why it's so important that we teach families. So when we go do an early intervention visit, we do what we call the coaching model or coaching method. So we coach the family on how to carry over these techniques, because what we say is, you are the child's best teacher. I might know some of the tips and strategies, but I'm here for 45 minutes. But you're with your child all day, every day. And if we can teach the family those things also empower them to know that, hey, I got my child to play with me today.
Mm-hmm. And
Something
celebrate those wins too.
Celebrate them all. Yes,
Uh-huh.
yes. And we're right there cheering them along.
Now, build your support village, and we've talked about this a lot. It's so important to have your support system.
Absolutely, absolutely. Support system, friends, family, comadres, doctors, we're all here to support families with children on the spectrum. Some of those organizations, Team Mario, Capable Kids, the Disability Chamber of Commerce, they do group events in the community so that they can meet other families and other children who are on the spectrum.
Now, your child's differences are what make them unique.
Absolutely.
And remembering that.
Right, and we need to celebrate the differences all the time, in all aspects of their development.
Now, autism is your child, but it does not define your child.
Absolutely.
That is not a
Absolutely.
definition.
It's not a definition, because every child with autism is different. They have different strengths, different likes, different needs. So autism in that child looks just like autism in that child, and we celebrate the differences in that child.
All right. Now, meet your child where they are developmentally. And I think a lot of the times parents want to be, oh, but I'm here, but I can push my child to be here. But you really have to meet them at where they are.
Right. And one example, we see that a lot in early intervention. We'll ask the families, what is it that you would like the child to do? And they're like, well, I want my child to talk in sentences, or I want them to say, Mommy, more juice. But the child isn't even babbling or saying words. So we acknowledge that the child is using gestures, maybe pulling mom, and then we build on that. So we're like, look, they're communicating with you this way. It might not be in phrases yet, but that's a win. That's a celebration. So we're going to start there at that point.
And then working and baby stepping to where we can see them advancing and
Absolutely.
and hopefully blossoming.
Sure.
Yes.
Definitely.
Now, focusing on the present and unconditional acceptance.
Mm-hmm. As a community, as a country, as a city, it's so important to accept all of our children with differences because we all are different. We've talked about autism being a spectrum. So ADHD is considered now on the spectrum, or OCD or ODD, like so many different diagnoses and so many different characteristics. So meet them where they're at and accept.
Mm-hmm. Now, your belief in your child's ability influences their achievement. So you have to support them, believe them, be their cheerleader, right?
Yes, so much research supports, like neurological research supports that what we speak to our children and how we believe in them and using those positive affirmations, those children tend to have more self-esteem and better relationships with others.
Mm-hmm. Now, focus on the positive. And I think a lot of the times, we tend to go to the negative, and even if you do have a slip or whatever, it's always making sure that we focus on the positive and stay positive, right?
Stay positive in all, yes. And we just reassure the families that they are their child's advocate, they are their child's voice, and they are the best for their child.
All right, and lastly, keep pushing the boundaries. So making sure that you go further than you did before, like in everything.
In everything. And because of people that came before us, such like, say, Temple Grandin, or other people who are big in the autism world, because they've pushed boundaries, we're able to speak about autism today the way we are, that it's acceptance, that we're celebrating differences. 30 years ago, it was not that way, but because of people advocating and speaking positive and believing, we're now able to embrace the differences.
All right, so how do you support a friend or a loved one who has a child with autism?
Don't overstep. Allow the parents to come to you. Don't offer unsolicited advice. So many times when we're home in the homes, we'll say, well, my comadre saw on TikTok that, or my comadre saw her neighbor's son who was on the spectrum did this or that. And we try to tell the families, focus on your child. And when say like the comadre is ready to wait for the parent to come to them, then she can offer the advice.
And again, it's about celebrating the diversity and our uniqueness.
Right.
And no two children are alike. They're like snowflakes.
Absolutely. That's such a great analogy.
Mm-hmm. Now, here are 10 things that you can do to help a family with autism that I thought were great. Being there. So you don't have to say anything sometimes. You just have to be present, right? And be there. And
continue to invite the family members out to outings or to go to dinner or to the park. Don't exclude a family who's just received the diagnosis that their child is on the spectrum. Don't exclude, continue to include.
Mm-hmm. Now, discussing autism and having conversation, because that's how we grow and that's how we learn, is by having these discussions, right?
Right. Having these discussions, doing your research. I know you and I spoke about credible sources. Make sure that you're learning things about autism that come from a valid place, things that have been studied and researched, because there's so much on the internet in terms of research on autism.
Mm-hmm. Offer to help any way possible, whether it's babysitting or whether it's running some errands or helping with picking up dry cleaning or whatever it may be. Be there and really support, right?
Offer to help, and sometimes if the family says no, do it anyway. So if you offer to pick up the kids or to make dinner and mom says no, bring it by anyway. It'll get eaten, but that goes to show that I'm here for you and I support you even without saying a word.
Mm-hmm. Don't judge.
Don't judge. Yeah, that's tough.
Mm-hmm.
I know that happens a lot, but it's so important not to judge. And again, if you can understand autism and see the child for who they are, the judgment tends to become minimal or less.
Mm-hmm. And then the last one, confidentiality. and making sure that you're not chismeando,
Yes.
that you're not talking to your comadres and sharing information, because it is a very private thing, and you should allow the family to have their privacy in that regard.
Definitely. As much as the conversations are important, so is privacy.
Now, one of the things that we hear a lot is that unfortunately we don't take care of ourselves. As caregivers, we're always aware of what the needs are of our child, let's say, but how important is it to make sure that parents remember to take care of themselves?
It's paramount. It's so important. If the parents are in a good place, the child is in a good place. And I know some of these local organizations have like Mother's Day Out or Parents' Day Out programs to where mom gets a little bit of respite. She gets a little bit of a break. Not from because the child is on the spectrum, but just a break from everything that is involved in being a parent.
So just making sure that you take care of yourself and don't miss your doctor's appointments. Don't miss, like, I know that a lot of the times it's like it's time for your mammogram or it's time for this or that.
Definitely.
You've got to make sure, because if you're not there for your child,
Right.
who will be?
Absolutely. And also I would recommend, as a parent myself, it's so important to have the conversation with your doctor. Just as you advocate for your child, if you're feeling sad, let your doctor know. Or if you're just not in a really good place, talk to your physician about that. They might be able to give you some recommendations as to help you as well.
And it's not just the physical, it's the mental as well. Sometimes you get the anxiety, you may get some depression, but it's making sure that you're speaking with the experts and in your doctors to get any possible treatment you may need, because
Absolutely.
ultimately it will help. By helping yourself, you'll help your child.
Absolutely.
All right.
Absolutely.
And as we wrap this up, what last piece of advice would you want to give to those people who are watching today when it comes to autism spectrum disorder?
My last piece of advice would be it's never too early. We've seen characteristics of autism in babies that aren't interacting or aren't engaging with the parent. If you feel it in your heart that something might be different, seek the help. Call ECI. We don't have to have a doctor's order to do an evaluation. We can be there as support. As I mentioned earlier, the diagnosis isn't paramount always in early intervention, but seek the help. The minute you see the concern, the minute you see something that might be different, seek the help. Early is definitely best.
All right, early intervention is key, so making sure you're paying attention. Well, thank you so much, Dee Dee. We really appreciate you being here.
Thank you for inviting me.
All right, and that officially concludes our webinar. Thank you for joining us. We hope you will continue to prioritize the health of your children, and we look forward to seeing you for our next installment of this Let's Talk Children's Health series on Wednesday, May 15th from 5:30 to 6:30 p.m. when we will talk about summer safety as children prepare for summer break. Like and follow the STHS Children's Facebook page for more details on our future Let's Talk Children's Health webinars. And to view all our previous Let's Talk webinars, all you have to do is visit sthsletstalk.com. Until our next seminar, stay healthy, stay safe, and please continue to prioritize your health and the health of your little ones.
At South Texas Health System Children's, your child's health is our priority. When they're ill or injured, we're ready to help. Our team includes on-staff pediatric specialists in infectious disease, cardiology, orthopedics, neurology, ear, nose, and throat, and more. Our round-the-clock care features the Valley's first dedicated children's ER. For more than 15 years, we've offered healing and hope for kids. And we're here for your family now. South Texas Health System Children's.
Where kids come first.